Dear friends, I think we can start. Yes. So welcome to this event organized by FAFCE and COMECE. And we are happy to host here this event in our premises. Welcome also to the people that are online. I see very familiar faces and who are based in Europe and beyond that could not join us here today in person. So it's also, I think, something very positive, and it's also a bit of the topic of this meeting we're having today. It's also very positive that we're going back, more or less, and as far as we can, to physical meetings. And we need them. Well, we need them, and we need to meet and that human touch. So we'll welcome also to our speakers, in particular the Dr. Dąbrowna Bach-Goleka. Thank you for being here with us today. From the University of Warsaw, who traveled specifically to be here with us in person today. We are very, very happy to have us with us today. And during the pandemic, and coinciding with the International Women's Day 2021, the Vatican has taken a strong interest in women, always had a strong interest in women, but it started to think about the woman in this situation, in this context of the pandemic, and published a cross-cutting executive summary of the Vatican's COVID-19 Commission entitled Women in the COVID-19, Disproportionately Affected and Protagonists of Regeneration. Perhaps Dr. Dolores Sanchez, who is connected remotely, will tell us a bit more about this later. Today we dedicate our event to women, as many of them have been put in the front line during the pandemic, acting as formal or informal caretakers and as essential workers. The main focus of our conference will be on the European Care Strategy. It is based on one communication and two proposals for Council recommendations on early childhood education and care, and on the access to long-term care. It thus offers us many elements for our exchange today, like work-life balance of parents, the access to childcare services, the support to the elderly, and the access to long-term care services. The idea behind this conference today, prepared by COMECE and FAFCE, is to learn from concrete experiences of women and to initiate positive changes in this recovery time, with a key focus on the living conditions of women. Questions for us today will be, for example, how did the pandemic affect the careers and personal lives of women? What specific challenges are women facing today? How is the European Care Strategy answering their needs and concerns? What could the European institutions continue doing in the future? As you see, this is a vast program, and I propose to get started right away. So thanks again to be here in COMECE, the ones of you that are present physically, and also the ones that are connected with us online. And I leave the floor to Frederique or to Alex, that will chair this part of the meeting. Thanks again.
Thank you, Father Manuel. Thanks a lot for this introduction. I'm Alix de Boissège, Policy Advisor for Social and Economic Affairs at COMECE, and I have the pleasure to start the moderation of this meeting. So this meeting on the European Care Strategy, responding to challenges faced by women in times of pandemic and beyond the pandemic. Just a few logistic things before we start is that this event is recorded. So now we will start with this event. We have received a nice video message from Commissioner Nicolas Schmit. He's the Commissioner for Jobs and Social Rights in the European Commission since 2019. He was also a member of the government of Luxembourg from 2004 to 2019, and he has occupied many functions as such: Minister for Labour, Employment of the Social Economy, Minister for Labour, Employment and Migration, Minister Delegate for Foreign Affairs and Migration, and he has also served as ambassador, as permanent representative to the EU of Luxembourg, and member of the Council of State from 1991 to 2004. He was also a member of the European Parliament in 2019. So he will propose a short introduction to the main EU social policies, some of them in times of the pandemic, and in particular, those aimed at reducing inequalities between men and women. So we will start with the video message now.
Dear participants, ladies and gentlemen, when the pandemic started more than 2 years ago, we could quickly witness the disproportionate consequences it had on women. Women were overrepresented in the most affected sectors, and they were hit harder economically. They were also greatly exposed to infection as frontline workers. Professions predominantly carried out by women, such as nurses, teachers, cleaners, and care workers, were among the most vulnerable. There were also more women in lower paid jobs or on precarious contracts, which were the first to suffer redundancies in the crisis. Apart from the direct health consequences of the virus, the pandemic also had a big impact on people's mental health. These are likely to be gender-specific and long-lasting. According to a recent study by Eurofound, the proportion of women at risk of depression stands at 59%, compared to 50% for men. And almost 1 in 4 women reported unmet mental health care needs in spring 2022. These are just some examples of the ways that the crisis exacerbated long-standing gender inequalities and reversed some of the progress achieved over previous years. Now, more than ever, it is essential that our policies are gender responsive and value the important role women play in our societies. The pandemic highlighted women's enormous contribution to schooling, care, and household tasks when formal care and social service infrastructures were down. We have an opportunity to recognize their work. The European Pillar of Social Rights Action Plan, together with the EU Gender Equality Strategy, are our compass to promote equal opportunities. Let me mention a few examples of our actions in this direction. On the 7th of September, the Commission adopted the European Care Strategy. This strategy is for the benefit of persons in need of care and their carers alike. Better care services will increase women's labor market participation and will help to close the gender employment gap, the gender pay, and ultimately the pension gap. This is why the Commission has proposed to increase the availability of affordable quality childcare services and long-term care services. We have also proposed to revise the so-called Barcelona targets and boost the participation of children in early childcare and education. Getting more women in employment would also help reach the employment rate of 78% by 2030, one of our 2030 European social targets. The Work-Life Balance Directive, which member states had to transpose in national legislation by August 2022 encourages both women and men with care responsibilities to make use of family leave and flexible working time arrangements to equally share care responsibilities. Furthermore, EU funding, such as the European Social Fund Plus, will continue to provide support to families through investments in education, employment, access to services, as well as measures against deprivation and poverty. Gender equality is vital to build prosperous societies that are fair and just for all. Our goal is to create the conditions for everyone to live, thrive, and lead. It is now our shared responsibility to translate our gender equality priorities into concrete actions to achieve a union of equality. Thank you.
So we thank the Commissioner for this video message to introduce some of the EU social policies, including the European Care Strategy, to support women in times of the pandemic and beyond. So the European Care Strategy, it is to ensure quality, affordable and accessible care services across the European Union and improve the situations both for caregivers and care receivers. And this strategy is specifically important for women, as we know that 90% of the formal care workers are women, according to the European Commission. Now, Commissioner Nicola Schmid has just mentioned some challenges faced by women and as informal and formal care workers, such as gaps between men and women in terms of levels of employment, therefore levels of wages and pensions. And with no further ado, now I will invite our next keynote speaker to speak more in depth about the challenges faced by women during the pandemic. So I will invite and pleased to welcome Maria Dolores Sanchez Galera. She is connected online with us from the Vatican. You are from Spain, and currently you work as coordinator of the research and reflection section of the Dicastery for promoting integral human development in the Holy See. You are part of the scientific committee of the economy of Francesco, and you have been teaching law and economics at the specialization course Fratelli Tutti at the Pontifical Faculty of Theology, San Bonaventura in Rome. You also have a vast expertise on energy law, energy poverty, and social justice matters. And in the past, you have worked for Caritas Diocesana. So one can say that you have at heart the common good and social justice matters, the cultural and educational matters for real empowerment of communities, the poor and civil society in general. So you will speak about the challenges faced by women in times of lockdowns, and please, the floor is yours. Just one thing is that after her intervention, we will have also a bit of time for questions, both in the audience, also from online participants. We are also following if you have some questions from online. So please don't hesitate to ask questions afterwards. Thank you.
Good morning, everyone. Thanks for the presentation. It is a great pleasure. Can you hear me well? It is a great pleasure to be with you virtually, distinguished members of COMECE and Federation of Catholic Family Associations in Europe, and fellow advocates for women. I would have loved to join in person, of course, but it has not been possible. And thank you for the kind invitation and for the opportunity to offer some words on the intersection of integral human development and the challenges faced by women during times of lockdown. As we well know, the pandemic has increased the vulnerability of countless women and girls across the globe, and there is a need to pay close attention to their experiences and struggles so they can fully participate, and not only participate, but also flourish in the regeneration of human systems in a post-pandemic world. Our meeting here today comes at a relevant time, As just last week, on November 25th, we marked the 42nd International Day for the Elimination of Violence Against Women. The observance calls for global action to increase awareness, promote advocacy, and create opportunities for discussion on challenges and solutions for women and girls, just like we are doing here today. In his video message last week to recognize the day, the words of the Holy Father remind us that our level of humanity is measured by how we treat women. And if we want to wave humanity into this or a time, we need to start again from women. And this citation comes from the homily of the Holy Mass on the Solemnity of Mary, Mother of God, on Wednesday, the 1st of January, 2022. On that note, I would like to draw your attention to two reflections on the challenges faced by women during the pandemic. The first reflection is that because women experience an increase in violence, we are called to deepen our approach to peace building and a more collaborative economy. The second reflection is that as women shoulder much of their responsibility as care workers, we must rethink and give value to care. So going to our first reflection, violence against women, we know that since the outbreak of COVID-19, emerging data and reports from those on the front lines have shown that all types of violence against women and girls have intensified. In the executive summary, Women in the COVID-19 Crisis, released by the Vatican COVID-19 Commission, our dicastery found that isolation, restricted movement, and stay-at-home measures have led to increased levels of domestic violence globally, while reports from around the world reveal an increase in the global trafficking of women. Without the security provided by a school, including food access, girls are more vulnerable to violence, sexual violence, and child marriage. In an effort to listen to the cry of the poor, this is coming from the Laudato Si', the Commission gathered the experiences of women around the world to understand in global voices the impact of COVID-19. I want to draw your attention to a story coming from Manos Unidas, from Mali. Janet Aguirre noted that she believed that cases of sexual abuse of young women would increase, and that with weak health structures that normally don't reach the entire population, and we know that this is a reality in Africa, in many parts of the world. We live in Europe, and we know that the rest of the world doesn't have the health structures that we have, not the solidity that we have. So the concentration of the resources in the coronavirus leaves women and girls without health care. She shared this story. We accompanied a woman to the clinic to give birth, but there was no doctor at all. All were in training or assigned to other services due to the coronavirus. Only a midwife could attend her. So the delivery had complications, and this woman died. Only the baby survived. Many stories like this one, Janet's story, exist and should stir our hearts. They demonstrate that an equal toll of COVID and urgently called us to seek an end to all forms of violence against women around the world through peace building and a more collaborative economy, one which values the leadership of women and sees how they may play a full role in contributing to the common good. Special consideration needs to be given to how women can be protected and supported. And an important way this is possible is by involving them in decision-making, especially in the fields of medicine, politics, and of course, economics. For example, countries with women leaders generally fare better overall during the pandemic because these leaders approach the crisis in a similar way. They consulted with health experts and implemented containment measures early. Furthermore, in general, women leaders invest more in human security and the greater role of women in a peace campaign. The larger the correlation with non-violent methods, And this is something that emerged from the research erogated from the Vatican COVID-19 Commission. The executive summary, women in the COVID-19 crisis. Going to the second reflection, women as care workers, the importance, I want to draw your attention to the importance of a collaborative economy. Although women are often not senior leaders, they are already fundamental actors in the labor force, both formally and informally. And during pandemic, they shoulder much of the responsibility as care workers. We know that. Why then, if women are already actively, critically contributing to the economy, especially during a time of crisis, have they been subject to discriminatory social norms and disadvantages? One reason may be the value society ascribes to care work, and in order to combat this, we must rethink and renew the value we give to care. Our frenetic lifestyles, in fact, harm deeply women's nature and their specific collaborative tendencies to human care. As care workers, during the pandemic, women face many unique challenges. For one, according to the United Nations International Children's Emergency Fund, women were leading the health response, representing roughly 70% of the global social and healthcare workforce, exposing them to a greater risk of infection. They were also shouldering much of the burden at home, as women traditionally perform unpaid and unrecognized care work, such as domestic services. The forced closures of schools and childcare facilities in many countries during lockdowns had a dramatic and immediate effect on women who became their children's teachers while often managing other roles. I can guarantee that as a mother of 3 kids and having one in Montessori schools, it was really challenging. It was really, really challenging. So research suggests that there are multiple trends emerging in mothers versus fathers labor market outcomes as a consequence of the pandemic and the distribution of care work. As a result, according to the Global Gender Gap Report 2022 from the World Economic Forum, the last 2 years have seen a relatively greater reduction from mothers in working hours, an increase in unemployment, as well as relatively greater drops in labor force participation. And according to the ILO, more than 2 million mothers globally left the labor force over the course of 2020. As these statistics make clear, women were and continue to be disproportionately affected by the marginal value society ascribes to care work, and that's a reality. Recognizing the importance of care in the public domain, not just the private sphere, offers a much needed alternative to the current human system of domination over creation, including over women. Therefore, we must renew the value we give to care, because a fragile world entrusted by God to human care challenges us to devise intelligent ways of directing, developing, and limiting our power. And this is coming from the Laudato Si. As the Holy Father notes in his 2021 messages to the ILO, care must be a dimension of all work, so that care is work and work is care. With this wider approach to care renewed value, care becomes a cherished responsibility, one that calls us to include and deeply listen to feminine voices of creation and wisdom. Now, to conclude, I would like to thank you for the incredible work you are doing to advocate for the empowerment of women. As artisans and builders of our common home, we all have now the responsibility to use the privilege at our disposal to support the flourishing of others. And we each have a unique role to play on this, I think. I am humble and grateful for this collaboration and for this talk today. And I look forward to continuing this precious work together, because I really think that there is a lot of work to do. on this. Thank you.
Thank you. Thank you so much, Dolores. Yeah, thank you so much for this very rich presentation in which you mentioned indeed a lot of challenges faced by women, the value of the leadership of women, the women leading the health response, the issue of the education and schools being closed, the lack of care services sometimes during the pandemic. And also thanks a lot for mentioning this International Day for the Elimination of Violence Against Women, mentioning as well human trafficking, sexual abuse, and different sorts of violence faced by women during the pandemic. So you have mentioned two key ideas in your presentation. One around developing a collaborative economy for the common good and peace building, and the other to value care workers and care. And in the end, this idea of care goes beyond, because as you said, care is work and work is care. So it goes beyond this idea of care that is only for, we care for society and not only for caregivers and care receivers. So it goes really beyond, it's a broader discussion. Thanks a lot for your intervention, and perhaps there are some questions in the room and or online from the participants. So if you have any questions, please. I see already a question online on the title of the research on women's mental health.
Oh?
On the mental health of women, but I think you mentioned a document from the Vatican during your presentation. Maybe if you could give us the title of that.
Yeah, it's an executive summary from women in the COVID-19 crisis, erogated by the Vatican COVID-19 Commission.
Okay, thank you. Thanks a lot. Are there other questions in the room? Yes.
Yes. Can you hear me? Yes. Thank you so much, Dr. Dolores, for your very interesting intervention. I realize that when we speak about care, the link between care and women, very often we think about the care that women provide, but actually, and it's linked with the commissioner's speech, women also need care. They are the first ones who need care, because if we don't care about women, then they cannot care properly about their children and education, and they cannot play their role in society and this leadership role and so on if we don't care about them. And for me, it's very revealing that the commissioner mentioned that, for example, women are more, there are more chances that women suffer from depression, for example. So it's not only about helping them to deliver, to homeschool and so on, but also just to care about their health. And this includes mental health. So what can we do, and what is the place of men in this support of women's health? Thank you.
I didn't hear very well the beginning, but if I heard well the main idea about care and women need care, I think the first challenge now, and that evidently came out from COVID, after COVID emergencies, but I think in our societies we know as women that the challenge, the institutional challenge, is to give more value to care work. So I think that's something very new that has started to have a place also in economic discussions. And lately I've seen how, for instance, the Latin America Development Bank has devoted a new program to institutionalize care, especially in Latin America, because it's a big challenge, especially there. And so how to devote not just more funding from solid institutional structures from the developed world, but to really create value and to empower women with institutional tools to have a balance between working life and care needs. Because it's not only about a balance in family between men and women shouldering care. It's about, we know that humans' nature, I mean, we give birth, there are particular circumstances that are part of women's nature, as well as elderly care and so many other work jobs that don't really have the institutional strength that some other job positions have today. So I think the big challenge now is to find this, to get to the global discourse of really a more collaborative economy in which the role of care is distinguished and has a place in our institutional settings.
Thanks
I don't
for.
know if this answers your question.
In a way, yes, but I still don't see a lot of work. For example, in the EU care strategy, I don't know if it is included the care for women, and for example, about their mental health, to let them, to give them the opportunity actually to work and to have leadership positions. And you're speaking about institutionalization.
Excuse me, because the thing is, I don't hear you well. I didn't hear your first part. Women.
If I may,
I really want to hear you.
Your question relates to the European care strategy. We will come
to the European care strategy. Okay, now
so
I got it. Yeah, that you don't see how in healthcare.
Yes, but we will have the roundtable specifically on this topic just after. So I'm sure.
Yeah, I think there is someone getting deeper on this European strategy, because of course, here in Europe, as I mentioned, this Latin American Development Bank new program to institutionalize care. I think in Europe it's easier because we have, let's say that we have been sensibilizing society, we have more specific institutions to take care of that. We have a lot of work done in gender, but still there is a big challenge in the world. And I think Europe could do in any way more than is done. Of course, I think maybe there's gonna be a deeper reflection on that in the next, in the next session about European specific laws. Thank you.
Thank you so much, Dolores, for this input on the challenges faced by women in times of the pandemic. And indeed, we will get back in the next part of the meeting about what is happening in the EU to tackle these challenges at the moment. So now I'm afraid we are a bit beyond schedule. I see there are other comments in the chat, but unfortunately we won't have time to answer to all of them. But thank you so much again for joining us online. And now I will give the floor to my colleague who will present our next speaker. Thank you.
It's my pleasure to welcome Professor Bach-Goleka. She flew this morning from Warsaw to Charleroi, and we made it from Charleroi to here in times of train strike and a lot of traffic. It was a great job. So it's our pleasure that you are here. You are an associate professor at the University of Warsaw, Department of European Law. You studied law and theology in parallel. We discussed that already in the car. So you served as the Vice Dean for Legal Research and International Cooperation at the Faculty of Law and Administration in Warsaw, and you have been appointed a judge ad hoc at the European Court of Human Rights in Strasbourg, 2016 to 2018. And since 2019, you're director of the Center of Canon Law at the University of Warsaw. You are very much engaged in the topic of feminism and women. We also had a great chat about that in the car. And so we are very much looking forward to your presentation. You will focus on EU law in support of mothers, and maybe we will get already some more answers about questions which were in the room. So thank you very much.
Yes, thank you very much. I would like to thank Father Barrios Prieto for inviting me, and Dr. Speranza for inviting me to this very interesting event. I'm going to speak about European Union law in support of mothers. I have 15 minutes, so it's really a quarter of time, but the topic is for quite a longer time to develop. So what I'm going to do is to focus on some crucial aspects of European Union law, and I would like to raise some controversial topic. I think I may stir up a debate. Yes, thanks a lot once again, and I would be very happy to answer any questions and comments on my presentation. The topic of my speech is to focus on European Union law in support of mothers, and I'm a professor of European law, and my overall major statement would be to focus on inadequacies of European Union law, and in the sense that it is not solely the law that is relevant to support mothers. It's not solely the EU law that is relevant to support mothers, and it is also the international law of human rights that is relevant here, and also the member states' law, because it is the law that the national law, domestic law, that implements the certain hints and recommendations articulated at the European Union level. And moreover, the questions that were raised in the Dolores Sanchez panel focus not solely on legal instruments, but also on other instruments that are to be designed not solely within legal sphere, but one may say on organizational sphere, and also on social sphere. To focus on relations, one does not have to deal with legal instruments. And somehow one may look on pandemics as a challenge, but also as a change, as a chance to somehow ameliorate relations within families. And this period of certain isolation, this period of certain stop interval may not be used solely to focus on or to engage in violence, but rather it may be regarded as a period to take efforts to somehow engage in mutual relationships within families, within marriages. So one may focus on pandemics also within certain positive impact, positive influence of saving relationships or ameliorating their condition. But coming back to my topic, European Union law on the issue of mothers. What are mothers' rights? What are mother entitlements as far as law is concerned? My first statement is that when one looks into human rights within international sphere, human rights are constructed within international treaties in a neutral manner. So it is impossible to say that those are female rights and those are male rights, because the body of human rights is based on the principle of equality. So the principle of equality of females and males, of women and men, means that every human right is to be enjoyed in a similar manner, in an equal manner, both by men and women. And the principle of equality is also to be applied in family matters, and it is the Universal Declaration of Human Rights of 1948, quite interestingly, that stresses equality within marriage, within decision to start a marriage, within the functioning of marriage, within functioning of family, stipulating that it is both for women and men, for mothers and fathers, and I'm grateful to Dolores to speak about fathers too, because it is an equal obligation and equal responsibility for mothers and fathers to take care of children and to take care of the family. The only difference when one focuses within human rights that has certain specific rules, specific entitlements as far as mothers' rights are concerned, is connected to the issue of maternity, of motherhood in the sense of pregnancy, in the sense of childbirth. So this is the issue, this is the specific issue of females, the specific issue of mothers and mothers' rights that are connected to this original state of women being pregnant and giving birth to children. And Article 25 of the Universal Declaration of Human Rights stipulates that mothers are entitled to special care and assistance because of maternity. And this notion of special care and assistance is being repeated in the International Covenant of Human Rights, in the European regional international human rights treaties. And this is the essence, one would say, of mothers' rights. So the first issue is the principle of equality. The second issue is mothers' rights connected to maternity and the support that should be given to mothers. And one may say that this support is not solely connected to certain social benefits, but also it stretches to work area, to labor market within the International Labor Organization conventions concerning maternity protection. It stresses also the importance of caring as far as healthcare services are concerned. And one may point to the obligation of the European Union member states to structure the healthcare system, to healthcare opportunities to provide a proper state of health for the population consent. And it is important not solely to mothers, but also to children. It is important within the development of particular branches of medicine. One may focus on prenatal medicine, which is of vital importance for women in maternity, in order to provide treatment opportunities in case of children before birth having certain defeats and certain health problems that may be subject to operations within the prenatal sphere, so before birth. It is the judgments of the European Court of Human Rights in Strasbourg that stress the linkage between the right to life, in the case of Syria against Turkey in the year 2015. For the first time, the court stressed that the issue of a proper organization of healthcare system is connected to the right to health. The issue concerned the case concerned the case of Mrs. Genk, who gave birth to a son, and the baby was being born prematurely and was not offered any treatment whatsoever because of certain problems with briefing, and there were not enough equipment in various hospitals in Turkey, and the court recognized that Turkey breached the Article 2 of the Convention concerning right to life, but within the improper organization of the healthcare system that did not offer healthcare services, medical services that would save life of this little patient, the son of Mrs. Geng. And the first statement concerning the European Union law in support of mothers is that it is the European law is providing various directives concerning maternity, the protection of maternity. The Commissioner Schmidt had referred to the work-life balance directive, to the directives concerning the protection of parenthood. But one may say that those instruments are designed in order to, on the one hand, to support mother rights connected to the period of pregnancy and the period directly afterwards. But the work-life balance directive and the European care strategy, in my opinion, should not be regarded as the instruments that are protecting mothers' rights or females' rights. But if we are focusing on the principle of equality, the principle of equality means that the choices, the opportunities, the possibilities, the incentives are equal for both males and females, and the opportunities to engage in various professions should be developed in order to help the representatives of males and females to engage in the activities of their choices. In case of mothers, the important provision that should be underlined in the process of the impact of European Union law is to focus on the social economy and the impact of the national rules for the possibility of work and performance of mothers. And it is the strategy on gender equality that may be analyzed in this moment. The strategy which is not a real hard law, but is a soft law, is a kind of certain recommendation for the member states. One may also look on the missing instruments, such as the invention of certain incentives for the mothers to return to the labor market after the period of upbringing children, and also certain sensitivity as far as the, for instance, the composition of the collective bodies, the bodies making decision, in order to include both the representatives of females and males in order to respond to the needs in question. I would be very happy to receive questions and comments for my presentation, and thank you very much for listening to my presentation.
Yeah, thank you very much, Professor. So are there questions in the room? Do I see some questions now? You seem to convince the people here.
I have a question.
Very good.
Thank you very much. Thank you for your presentation, Professor Lobic. You were talking about the principle of equality, and before, I mean, there was also the commissioner who spoke about equal opportunities. And as other speakers also mentioned, women were the ones who were mostly impacted during COVID time, and especially now during the post-pandemic, because we see the consequences, and also especially on health issues and also labor issues as well. But on the other hand, I think we must bear in mind that if we analyze this from an intersectional point of view, women and men are different, and also women themselves, they are different types of women, because you have, let's say, for example, in the European Union, there's also the issue that you have lots of migrants, and during the period of COVID and also post-pandemic, it's actually the migrant women, the refugees, and racialized women who are actually mainly suffering from this. And on the other hand, we hear commissioners, we have lots of European laws indicating equal opportunities, but in practice, we see that it's not really being much implemented. And on the other hand, we see that even within European Union, you have countries, especially Eastern European countries like Poland, Hungary, or Czech Republic, and Croatia, Romania, and Bulgaria, who are having lots of issues in providing a real equality, both in labor market and also in other spheres. So how can we tackle this issue, and how can we make it possible to actually ensure a real equality, as you were talking?
Yes, thank you very much for the question. I was focusing on inadequacies in law, in the sense that one may say that the law is being structured, is being formed in a proper manner. When one thinks about human rights law, about European Union law, the principle of equality, the principle of non-discrimination due to gender is there. But what is lacking is certain sensitivity as far as concrete policies are concerned. So on the one hand, one has the law in books, on the other hand is law in action. And I may use the example of German provisions concerning higher education. Those provisions are based on a certain commitment to science, in the sense after habilitation, one has to change the university. One has to move from the university one received habilitation in order to start the profession elsewhere. And this provision, which is being structured in a Weberian sense in order to strengthen the quality of research, has a negative impact on family and has a negative impact on women who are sometimes sometimes they would like to pursue the scientific career, but because of this rule, they are sacrificing their commitment to science because it is impossible for them to move and to leave the husband, the family, and to pursue the job elsewhere. So it is an instance of indirect discrimination. The provisions are not constructed in order to hamper women's performance in science, but in fact, in practice, it is men who are pursuing scientific career and women are left behind. And what is needed, in my opinion, is sensitivity. For instance, the Polish president, Andrzej Duda, has a few days ago appointed the Advisory Council for Scientific Research, which is composed of 18 members, and all of them, 18 members, are male. So around 40% of scientists in Poland are females, but there is no female in this advisory board. It was a mistake, the officials admitted it. But what was lacking was this sensitivity. Every collective board should be constructed of males and females, because males and females, it is not enough time here to elaborate on it, have a different attitude to problem solving. Men are more based on rivalry, on competition. Women are more connected to ethics of care, to certain hospitality, non-hostility. And therefore, it is needed to have those two methods of problem solving, of making decisions and one may say that a completely human method of living, of responding to life is based on males and females, because it is the full human attitude.
Yeah, so no more questions. I have to see that it's already nearly 11 o'clock. So thank you very much again. And now it's my pleasure to hand over the moderation to you, Benedikt. Yes.
Good morning, everyone. It's a pleasure to have you all here. We will now we'll start the panel with great panelists. I welcome all of you. And as we are a bit short in terms of times, I will directly start with the introduction of our first panelist, Madame Dana Bachmann. You are head of the unit of the Directorate General on Employment, Social Affairs and Inclusion. You focus in your work on the question of social protection, including access to social protection, adequacy of pension, and long-term care. You have been before head of unit of DG Education and Youth, and as well you were responsible for vocational education. So you're not only an expert on long-term care, but on all those questions related to education, apprenticeship, and adult learning. So thank you very much for taking the time to be with us today, and I will give you the floor right away.
Yeah, so good morning, everyone, and very happy to join you for this debate. And I'm also, because I have been in many events following the adoption of the European Care Strategy, but I think this is really one of the first events that I attend personally that is specifically looking at the gender dimension in care, and also all the challenges that women are facing in normal times, but also during times of pandemic, and now also in the current energy crisis and triggered by the war in Ukraine. So in my intervention, I will maybe just say a few words about the care strategy, but then really try to zoom in on what is it that we hope that the care strategy will help to address and improve gender equality. So first of all, when we started preparing the care strategy, we really wanted to take into account both perspectives, the perspectives of those that are in need of care, but also those that provide care. And among those providing care, obviously, there is the formal people in the workforce, but also all the informal carers. And it is very clear from the outset that when we talk about care, there is a very, very strong gender perspective. And I liked the intervention, the question you had earlier, for example, because we try to tackle not only the fact that women take a lot of care responsibilities, both as informal carers, relatives, parents, but also in the workforce, they represent the great majority. It's a sector that we all know it's very much affected by very difficult working conditions, difficult working time, difficult physical tasks, exposure to abuses and different forms of violence, low pay, and also very limited opportunities for progression in career. But we also try to look from the perspective of those needing care, because especially when we talk about long-term care, as women live longer, and they tend to be alone at those advanced ages and be very much in need of care. But because of all the time they invested in caring for their children, for their relatives, they had to withdraw from the labor market. They developed probably more serious health conditions, and they have to face these care needs with less money and yeah, with higher care needs. So obviously there is also very strong dimension of how do we care about older women. Now, when it comes to the care strategy, we have structured it according to 5 areas. And I think each of these areas, if member states, but also us within the remit of EU responsibilities and stakeholders take some steps forward, this will all contribute to better gender equality. So if I take the first basically key message of the care strategy is the need to expand and to increase the offer of care services. And here we also look at the dimension of adequacy, availability, affordability of care services, and very importantly, quality of services. You may know that we have also put together, as part of the care strategy, 2 proposals for council recommendation, one on the revision of the Barcelona targets on early childhood education and care, and one, the very first one, EU initiative in this field on access to high quality, affordable long-term care. So basically through these proposals, we also give the tools to the member states in terms of how key principles they should guide their reforms and investments in these 2 areas. And we were also very happy to see that the negotiations, okay, they were a bit more difficult on Barcelona targets because of the targets, but on long-term care, they went very smoothly. And the proposals will actually be adopted next week by the EPSCO. So everything went very smoothly, and we hope there will be implementation action at national level. So basically, by expanding care services, obviously we facilitate access to care services by women, but we also improve the work-life balance, the support mental health, better labor market participation of women, because they have a support infrastructure and services that help them combine to their best care responsibilities and private lives and of course professional lives. Then a second dimension of the care strategy is the need to improve working conditions in the sector. As I said, 90% of the workforce is women, and obviously they are the most affected by very difficult working conditions. And in that respect, we are, with the care strategy, encouraging member states, but also social partners to work towards improving pay in the sector. Collective bargaining, social dialogue can help very much. Improving working conditions, and at the EU level, we are going to undertake a more in-depth assessment of the extent to which the current acquis that we have on working time, working conditions, but also health and safety at work is applied in the care sector, and to identify what are the concrete implementation and enforcement gaps. We also propose to capitalize on skills agenda, which is a broad agenda of the Commission, in order to improve skills opportunities in the sector, and also focusing on the most vulnerable segments of the workforce, and these are in particular migrant and domestic workers. And again, we know that these are the ones where women are predominant, and they have least, let's say, they are exposed to most abuses in terms of both labor and social rights. When it comes to carers, for long-term care, we call them informal carers, so caring for your relatives, your friends, people in your social environment, but also parents, people with caring responsibility for their kids. There is another big block of different actions that we propose at EU level, but all, of course, building very much on what we have already in place, like in the work-life balance directive, with some actions that are foreseen in terms of better communicating on what are the rights deriving from the directive to support also better take-up, also campaigns that are combating gender stereotypes, but will also have closer focus on gender stereotypes in the care sector and in caring responsibilities. Then also actions to support combating discrimination at the workplace for those that are taking up family leaves, and also to support family-friendly environments at the workplace as such. Then we are also pointing to a number of actions that member states could consider, including better support for informal carers, support that goes from training, psychological support, also financial support in terms of pension credits, for example, and also better, let's say, mapping at each member state level of who are the informal carers, how, the impact that informal care has on personal lives or economic situation and on their well-being. A fourth building block of the care strategy, it's about investing in care, because what was very important with the care strategy was to pass the message that care, it's an investment, and not putting more money in care actually comes with huge economic costs to individuals, to society and economy. And we were very happy because ILO has also helped us to produce some stronger, let's say, financial calculations showing what is the return on investment by expanding and improving care services, and also valuing better care work, both in the formal sector and the informal care work. And I think that's quite important because we have done a study, for example, on informal care in long-term care, and we have really found out that the equivalent economic value of all the hours investing is actually much higher than the public investment in the long-term care. So I think it says a lot about how much care responsibilities they are still much more pushed towards family, individual responsibilities, rather than being absorbed by the public authorities as a public good and public service. And last point I wanted to make is, of course, also linked to the care strategy, the last building block, it's about better monitoring, better evidence-based on all dimensions of care. And I think this is quite important because we try, obviously, for everything to have gender disaggregated data, which is very much supportive in building up the arguments of the need to have targeted measures in this domain. But also we are trying to push for more, let's say, statistical comparable data when it comes to long-term care, but also to informal care in terms of time use that women make and men, and then we see obviously the big gaps there also in relation to care. So we hope that all this actually are different tools, instruments that will be available for different stakeholders to work, to use them in their national networks, constituencies, and we think it's also important for all of you to follow, obviously, what the national governments are going to do in terms of implementing the Council recommendation. Obviously, this is not a legally binding instrument, but still it's an instrument that has the potential to trigger some momentum and some action and changes at national level. Thanks.
Thank you very much, Madam Bachmann, for stressing the need to improve both quantity and quality of care, and as well to create a structure of support for mothers, be they working when facing discrimination in the workplace or at home when they actually do the work, but they might need some support, especially when it comes to mental health or training. So we will take the question after the different speeches. So please feel free to ask questions on the chat or keep it in your head while we have the other panelists. So we will move on to Margarita de la Pisa, member of the European Parliament from ECR Spain, and you are very much advocate of women, family, and life within the European Parliament. So please, the floor is yours.
Thank you very much. Thank you very much for in this event that is completely attached to the kind of topic that I'm used to work, because I'm in FEM committee, you know, in ample committee, but in MB committee, so all around cares. And it's true that in this topic around cares, we have a challenge. And it's great that the European Union want to work in this topic and trying to find solution, because it's something that for sure we have to develop. No? Just for starting, I think that the first thing that maybe will help us is to spread a positive vision about what cares mean. Because as we are seeing after the COVID, we only talk about how hard was being in our houses, and it's true that there was a kind of moment here today that is dramatic, you know, especially because it happened in our house, in our home, where it's supposed that we have to be sure. But also others have the sensation that it was like a quality time with life, the first time maybe for many women to be able to stay at home, taking care of their kids. Also many times the first time for fathers. and it was also a positive, and everybody now is like missing these days in a way. It's true that not everybody have the same sensation, but I think that it's important to understand that now we have a lack of time with our relatives, and the professional life, it's in another dimension, and always we give, because I think that is because we are professional, we are responsible, and we give the professional life always like a priority, no? But the truth is that at the end of our days, what we are also our happiness, no? It's attached to the professional life, but also in our personal life and what happened in our family. So we have to put this also in another level, the professional life and family life. And so this vision should be taken into account also when we try to approach care strategy. Because it's true that if we see this as we are, I think that all of us, we have the responsibility to take care of others. We have been care when we were babies. We are going to need cares future, so it's something natural. And we will find the happiness also giving cares, because we always see that the happiness, the need of the ones that need help, but also there's a need to the ones that want to give care. And we will not be in peace if we are not able to do that. That is something that is happening now, because the professional life have a big dimension in our lives. So, and after we always hear, I'm not able to care my parents. Sorry, we have to do something to make it able. And so it's very nice to have this care strategy. The first meeting in the EMPA committee and FEM committee bring a lot of hope, because I see that the goals that all the members of parliament, all the groups were aligned, that they need, that no one that need help not have it, so everybody have to receive the cares. The family is the better environment to receive this care and giving. Everybody demand flexibility to adapt the measure for the moments. It's not always the needs is different, even for the same passion of the same change in the development of the disease. So we have to add the flexibility, and the bureaucracy sometimes not bring us this facility, because sometimes you have not even the recognition that you are somebody that need help. We see this in disabilities or in elder people, and makes that very difficult to, so we are like talking about support, but everybody have to do something that is flexible and with efficiency to bring the help in the one. So, and also everybody was agreed that national level is something important because the situation and the culture of each country was different. And also the caregiver, because if somebody needs help, the first is to have a caregiver that can provide the care. And also that another idea was so important, it was that reevaluate the cares as a concept, no? Because it's true that sometimes the women, we are not doing a better strategy to reevaluate the duties, not our duties, because they are not only ours, not the duties of course, because sometimes we are saying, no, it's not fair, we are doing all, for example, after the pandemic, I don't understand what we are not saying. We have to be proud of women, because it's true that the situation in the pandemic will be completely different if the women will not have this attitude, if the women will have not this vocation of service, if the women will not have this, and we were essentials. And we have to be proud to bring and make this, make the others understand that somebody can be happy and giving, because looks like that is always a weight, something that is that you should like, and always about giving more value to other profession and not cares. So I strategically, I think that is not a good idea, because it's like we are giving less importance to this kind of. So these goals, we all have the same goals, and now we have to analyze if the strategy that we as politics we provide will fulfill these goals. And I think that we still need to more reflections, more debates, and also I think that is a good approach. But I find that there are things to work with. For example, there was like a strategy that put all the caregivers, professional and not professional ones, together. So sometimes there are not good understanding. So about, for example, the evaluation or labor condition. And in the same paragraph is the not formal and informal. But informal, that is something that I will stop later with this, is the family member. So it's not the same. I mean, we need to that's why our group presents an alternative test. It's true that now we will have the directive. So we have a lot to work on it. The politics wants to bring a tool that really help the people that need help and really need the caregivers, workers, and also the caregivers. I stop again with this formal and informal. It's hard for me to see that in a care strategy, the family work not even appear. We are considered informal caregivers. And I explained that in Spanish, informal is like something that you have to change to formal. And the family members have to be just the opposite. The one that will be the formal care of the person will be the family member. But why we don't say family? Okay, maybe sometimes there are people that are taking care of others. That is amazing that they are not. Okay, say maybe attached care or something like that. But and also because also the goals are not respecting the goal to give the priority to the family environment, because as we are seeing, like we are putting all the effort in this artificial structure that of course that have to be there, because not everybody have the chance to have somebody of their family that support. But at the moment that the family member can, we have to do our best to let this mother or this daughter to take care of their fathers, try that the people they finish their life in their houses at the moment as they can. Of course, if they can't, we will need all of this structure, because even being the family needs support. So it's not just out or in of house. I think that should be out if we have not help, but even out of our houses, we as a community, we need to realize that we have a responsibility even with the residents of third age that we have in our So, I mean, we need like little and details and local policies. So it's good to have this idea, but also we need to understand that it's a responsibility of everybody. And it's not just care, just give the water or feed. It's also warm. The loneliness is the worst, is the poverty of our days. And we have to resolve it, you know? So I think that we have the need to keep this kind of conversations. I think that the Catholic Church had a lot to bring, because our spirit is always providing and understand this as something natural and something that should be supported without even thinking yes or no, or it's not a decision, it's something that you have to do, and you will not be happy if you are not going to do it. So I don't want to make it longer because I know we have a lack of time, but so I think that we need to keep this debate open and not try to make positions about here or there. Talk and also try to make it true that it's good European guidelines, but the better approach will be face-to-face, locally, and being sure that locally all the houses, all the families, all the know each other, build communities, and realize, and it's true that the church in these cases is the best way, because we found a community in where I'm living. We have a register of families that maybe are in risk of being loneliness, and you have the telephone and they can talk and visit. And you know, sometimes there are little acts that make that somebody you know, change completely the situation of this day, to being completely sad, and a visit of somebody change, and well, whatever. I finish my speech because it's a nice topic, and I will be talking about it.
Thank you very much, Margarita, for stressing the need to reevaluate the value of care, and to have a very flexible approach when it comes to formal and informal care, and that we need to be very cautious about having all the very broad and diverse reality when it comes to care in Europe. So I will now move on to Shannon Froman, your Advocacy Director of Caritas Europa. You oversee all the advocacy work when it comes to the European Network on European Union, in areas related to migration, integration, social economy, social rights, and social policies. You are a very busy person when it comes to all those topics. Thank you so much for being here today, and I give you the floor. Thank you so much.
Thanks to you as well. I think just to respond to the last point, it's an important element to remind that families are a vital cell for our society. And it reinforces, though, the focus on the member state level, which has different welfare state models that also have a different response in terms of responding to care. And in terms, my immediate reaction, ensuring that people who want to offer care services can do it happily, requires that there are standards in place to ensure that the quality conditions are there. And right now, what Caritas sees is a complete crisis in the social care system across Europe. And I will try to touch on some issues, knowing we have very little time left. But what I think is important to mention is just how complex this topic is, that it's overlapping with so many different issues, evident by all the speeches today. I expected by now that everything I wanted to say would have already been said, and many of the things haven't even been touched on yet. So it just goes to show how complex this issue is. Just to summarize really quickly, we know that almost 90% of formal care workers are women. Around 80% of care provided in Europe is provided informally, not by professional care providers, often a family or a community member, as you're suggesting. The fact that 75% of informal carers are women highlights significant gender inequalities that are produced by unbalanced gender distribution in care. This situation is further aggravated given the unequal access, the high costs, and the growing waiting lists for professional social care services, because there are not enough people doing care, so there are long waiting lists. There's also a distinct lack of respite type services, and this imbalance is a major contributing factor to the phenomenon of the feminization of poverty in Europe, with women more likely to experience poverty in later life than men, and are thus more likely unable to afford long-term care. That has definitely been mentioned. I want to reiterate it though. Additionally, over 80% of social care workers are women, many of whom are underpaid and have unattractive working conditions due to historical misrecognition of the role of carers and their essential contribution to the running of the welfare state. This is also largely down to lack of recognition given to social care services in general, contributing also to the social care crisis and long-term care more specifically. It's important to acknowledge that while most of the frontline workers are women, most of the managers are men, highlighting the remaining glass ceiling and gender equality challenges within the social care sector itself. Furthermore, there's a lack of integration between social and health care, increased overemphasis on bureaucracy, also what's been said, rather than on social impact, a misplaced marketization and commercialization of social care services, and a lack of investment into home and community-based solutions. All combined together creates a social care sector that needs targeted attention and support. In addition, this is no longer just a regional concern. The issues of inequalities in the care sector are more rampant and thus require a European solution. Not surprisingly then, Caritas Europa is very pleased by the EU care strategy. In particular, I'll focus now on the Council proposal for long-term care, although there's certainly the link to the early childhood care, education and care recommendation. But I think for dealing with some of the challenges I mentioned, much more attention is needed immediately on the long-term care strategy. And in this regard, what we particularly like about the EU care strategy is its focus looking at both the care receivers and the care workers, both professionally and informally. And we welcome the initiative. We've provided a response that you can find on our website. We can share it also with the participants or via COMECE and FAFCE afterward. But we think that in particular, I'm trying to skip over things that have already been said to save time. What is vital now is, of course, first, the adoption of the care strategy in the EPSCO Council, but of course, the development of the national action plans at the member state level, and what's really going to be measured and monitored. And of course, there weren't specific indicators specified in the EU care strategy. And so the work of the SPC and the Commission will be vital in ensuring that those indicators really do speak to our recommendations. And if not, then this is all going to be another, really similar to your presentation from Warsaw. It's going to look great on paper, but when it comes to the actual implementation and the achievement, will remain open. What we in particular like in relation to the care strategy and supporting women is that it seeks to address the gender care gap by ensuring fair and dignified working conditions and wages in the long-term care. It increases the availability of childcare and complementarity of various types of formal care services and informal care. There's a reference to the social economy and the recognition that social economy organizations are important partners and has partnered with others to try and ensure women engage more in this area. And I think this also touches on the previous speaker's points about empowerment and involvement of women in the policies and solutions that impact them. Then we also think that the care strategy is valuable in drawing connections to the EU gender equality strategy. both continue to be important for increasing women's engagement in the labor market, addressing occupational segregation broken down by gender, overcoming the earnings gap between men and women, and both attempt to foster the equal earner, equal care model, which could support women in transitioning from unemployment to employment and from part-time to full-time employment, thus also addressing the pensions gaps and the problems for elderly women to pay for their own care needs. And of course, it's been mentioned already, the link of the care strategy to the work-life balance directive, encouraging equality between women and men through measures such as parental leave, care leave, and flexible working arrangements. And the legislation should help working parents and working informal carers to keep their jobs and adequate income level. Nevertheless, that being said, we miss a huge section. It's potentially there, but not specifically, not explicit. And the reality is that there are major differences between European Union member states. There is a major issue about achieving upward social convergence. And we know that since the fall of the Iron Curtain, European countries have not enjoyed the same basis, the same starting point in ensuring the delivery of social and even medical care professions and care provision. There have been vastly different levels of spending and investments in the care sector from one country to the next. And as a result, there have been wide inequalities across the care sector in Europe, with direct impacts on care receivers, care providers, as well as care workers, bearing in mind the latter, which are mainly women, as we've said. And at the same time, there's not been enough upward social convergence, which has resulted in Central and Eastern European countries being poorer than their Western counterparts. And this fact has contributed to the current crisis in the social care sector in Europe, with an over-reliance on cheap labor, typically migrants and mobile EU workers coming from poorer countries to deliver care in richer countries, where they manage to earn more money. This is evidence of an unsustainable underfunding of the care sector across Europe, with major differences between countries, which limits innovation and implementation of more effective types of services. We also know this impacts greatly on care drain. The phenomenon is so dire that some countries like Romania are struggling to have enough qualified care personnel to provide care within the country, as so many care workers have moved to wealthier countries where they can earn higher salaries, many in Austria and Germany and Switzerland. And the reality is that Romania now has so few care workers that as soon as they qualify someone, that person moves to a Western neighboring country. And so quality care in countries like Romania doesn't exist, because as soon as they're qualified, they disappear, okay? The immigration of significant parts of the population is also proving detrimental to the children and families left behind as a result of people migrating to perform these care work duties elsewhere. And the impact of immigration on family structures remains problematic, sometimes even dramatic, considering the negative effects of care drain, labor force depletion, and rural exodus. The loss of human capital not only affects local development, but it contributes to aggravating an already poor situation for children due to the immigration of adults in many countries, as typically mothers leave their children to work abroad. While the intention may be positive to earn money to provide for the family, the result can be very painful for the children left behind, with lasting impacts on their social and emotional development. Of course, one of my members from Caritas Austria recently highlighted the fact that many of the care workers are older, around 55 years old. And so they're not young children anymore that they're leaving at home. Nevertheless, they're leaving behind their elderly parents, who have no community or family or even a care system in place to care for them. So this sort of immigration is definitely having negative impacts on the economic development, the work and pay conditions, and the social cohesion on the country of origin, where there's already a skills gap and shortage of qualified care workers. And of course, in countries where care is already under-resourced with limited educational infrastructures and funding, there tends to only be a small pool of skilled candidates, as I've already highlighted. What's also important to note is that this sort of care drain and circular migration is negatively impacting the cost, quality, and availability of care services, as well as the investments to improve the pay, working, and staffing conditions. And the benefit of remittances being sent home to sending countries doesn't compensate for the loss of talent and skills, and the important loss of tax contributions, and the detrimental impact of care drain on the workforce in the sector and on the abandoned children. Because of all this, Caritas has been working quite extensively in the last years, many years actually, in trying to recognize that migration can be, or immigration, I should say, can be quite negative on the countries of origin. Generally, our work on migration focuses on the need for more regular labor migration channels and recognition that migrants contribute to our societies, both countries of origin and countries of destination. But in this area of care drain, we've been becoming more conscious of the fact of the negative aspects and the importance of fostering conditions by which people can remain in their countries of origin, and also promoting circular migration so that people can travel, learn a language, work abroad, earn some money, but go back to Romania in this case. And so we've set up exchanges with the Caritas organizations that foster qualified training and standards for care and quality that they learn. And then they work at Caritas Switzerland or Caritas Germany, Caritas Austria, for a short period of time, sometimes just 2 weeks, sometimes 3 months. And in that time period, they sometimes earn enough money, especially if they're in Switzerland, to be able to go back to Romania for the remainder of the year. And so they do this occasionally, and it's not a permanent immigration. It's a circular migration that allows this exchange, because the reality is people are going to migrate no matter what, if the conditions at home do not allow for a decent standard of living. And so this is one of the areas that I will skip through all the things we're working on because there's just not enough time, but it's one of the areas that deserves much, much more attention in the care strategy and in the communication on it. Why the care strategy does talk about partnerships, which means only if you're familiar and working on the topic of migration, that it's setting up partnerships between third countries to partner with EU countries to be able to send people. But what it's not addressing at all is the need for more upward social convergence and the reality of this disparity between wealthier and less wealthy countries within the EU, and the continued impact this is going to have on families, on communities, and on care services, and particularly the working conditions of the living care workers who are continuing to be exploited and underpaid in their home countries, and often abroad because they're then in an undeclared sector. I stop there for lack of time.
Thank you very much. Thank you very much for stressing those different challenges that social care system face today, and especially all the migration aspect of it that we sometimes overlook, or at least maybe presented in one light. It's important to, as Margareta was stressing already, to have a flexible and precise open discussion on that. Sadly, we won't have time for the question. I do apologize for that. I hope that we will be able to maybe do a proper follow-up, or maybe if someone has one question and is one sentence that allow for a 2-sentence answer. I have a candidate in the back and then another one. So please be very short. Thank you very much.
You mentioned the pillars for care strategy. One of the pillars is to improve the working conditions of the workers. I've read somewhere, I think, the press release of the Commission, that the Commission is trying to foster social sectoral dialogue at EU level in the field of social services.
And I have one also for Adana Bachmann. How do you see the discussion in the council about the
Yeah, so I will start with the last one. So basically the council did not discuss the care strategy as a whole. So far they discussed the two proposals for council recommendation on Barcelona targets and long-term care. In DG Ample, we followed the long-term care and actually we found them very good, and there was lots of interest even in making some provisions more forceful, which was quite interesting to see, and it doesn't happen a lot. But on the other hand, there were lots of discussions because they were, as always, I would say, concerned about the monitoring arrangements and extra burden coming at EU level. So now in the version actually that they will agree, you won't have a reference to national action plans, but there is reference to the fact that they will need to communicate to the Commission the measures that they plan and they intend to put in motion in order to implement the recommendations. So I think it's not a big loss because the scope of the action plan was precisely to do that, to review how is our country system compared to what the council recommendation asks, what are the areas that we need to focus, and then to decide, okay, these are the measures that we are going to roll down. As regards the sectoral social dialogue, as you know, the Commission is working to prepare a Commission initiative on social dialogue. And of course, part of it is also linked to the review of the whole sectoral social dialogue. And we are still in the preparatory stages, but colleagues in charge of this initiative are basically in touch with social partners to see the modalities for setting up such a sectoral social dialogue for social services. And I think the initiative should be adopted sometimes beginning of next year.
Thank you very much for your very brief responses. Another one sentence question, maybe.
I have, well, two questions. One is, I see the importance of informal care, and this is very important that the strategy is taking care of that. How is that compatible with the Barcelona targets and the policy of women participation in the labor market? And then there is another question concerning this, of course, problem of a lot of immigration for caring. I think this is very logical, and this is almost impossible to avoid because of the demographic crash. We have a demographic crash, we have less and less young people and more old people. So at the end, only the richer countries will have carers because they are the ones that are able to pay more. So is this care strategy taking into account this demographic crash, which is the problem of Europe?
Well, I think it is, especially as regards the long-term care, very much driven by the demographic trends and the idea that already now we have many people who don't have access to long-term care. But then as we are aging, these needs will only increase. So Europe should better be fit for tackling those needs. And then on the migration issue, I wanted to highlight that first, I mean, I come from Romania, by the way, and I have my own views on the care system, but I think it's a issue that every country in the EU is facing, no matter if it's a rich or a poor country. It's an issue that is faced by everyone. And of course, the solution is to increase and to improve working conditions everywhere. So basically, I think that is a bit the, let's say, intervention mechanism that you can reduce migration only when conditions are in a given sector, in a given country of such nature that they don't incentivize people to go abroad and look for better jobs and better lives. On the other hand, I would also say that the freedom of movement is one of the core values of the EU, and that is not being put into question because I think it is for each individual, each family to make their own choices in terms of where they live and how they share between their family lives and such. So, but obviously there is the need to push everywhere in the EU this upward convergence, but the guidelines, the policy vision that is set by the care strategy and the council recommendations, it's all about setting where everyone should go towards. And on the compatibility between Barcelona targets and informal care. First, I think indeed we have a bit of terminology issue. We talk about informal care, especially when in long-term care sector. I think in terms of parents' responsibilities, of course, this is not informal care, it's really caring for your child. And there is a very strong compatibility because it's not that by the fact that the children are part of the day in formal care services, that means that parents, we are withholding responsibilities for them. It's about trying to share between your care responsibilities and your life, professional, private lives, and so forth. So I think there is full compatibility, and the idea is to have greater support, structure, services that allow to combine between care at home and in the family and care together with other kids in a community that is anyhow the pathways that the kids will take when they start with compulsory schooling as such.
Thank you very much. Thank you very much for your different answers. Thank you very much for your different speeches, and we'll just scratch one element that you said in your speech regarding you said support to informal care as well when it comes to the compatibility with the Barcelona targets. You mentioned the question of training, support of mental health, and mapping. So I would be very interested to see a mapping on, for example, stay-at-home parents that work full-time for their children and do not work professionally, but with their children, in terms of how you can support those specific people and person working. So thank you very much for everyone for attending today, participating, all our speakers, our warmest thanks. We are very late, so I will directly give the floor to my Secretary General, Esperanza, for the closing remarks. Please do not leave, we still have the closing remarks. Thank you very much.
Okay, it's very frustrating indeed to arrive at the end, and I would like to say so many things. You can look my notes here, but I have in theory 5 minutes, but as we did not really respect the timing. Thank you very much to everybody for your presence. In time of post-pandemic times, it's not obvious also to have this in presence meeting, but we are very, very happy of your participation in presence and also online. We can see you, those you are connected online. Thank you very much for your active presence, indeed. I was many things. Father Manuel, starting this event today, was asking very concrete questions, and I think we answered many of that, or at least we gave food for thought. And because this event is not coming out of nothing, is in really, and you understood that it's very clear in the framework of the presentation of the European Care Strategy, but it's also in the framework of what we already did together with COMECE since before the pandemic. This reflection paper that we started on the role of the elderly in times of demographic change. You were referring about the demographic change, and this is we were thinking about it before the pandemic, and then the pandemic came, and everything became much more urgent, much more evident that we needed to give our contribution. And I was very happy also to hear that Dana Bachmann from the European Commission that it's maybe the first event where she sees this women perspective upon the care strategy. And I have to say I'm quite proud of that. That's the voice of Catholic bishops in Europe, which is COMECE. That's the voice of Catholic family associations, which is giving this perspective in a new way. Because as we were saying before, this is something, I think Margarita was saying, it's something natural. This reverence, which is due to the woman. I'm quoting St. Paul VI here. This is natural for us. We owe our life to a woman. It's not just because I'm Italian, so I love my mama, but it's really because this is a matter of fact. And when Commissioner Smith was speaking about the fact that the pandemic highlighted the women's enormous contribution to the common good in the end. It's exactly what we were saying also during the pandemic concerning the family. And we said also together with COMECE that the pandemic simply put a light on what the family was already doing in a hidden way. And there is no contradiction between families and women, saying between what Commissioner Smith said and what we also said, because motherhood is at the heart of the family, and this is this difference. If starting from this principle of the equality that the Brockna Bakalecka was mentioning, this principle of the equality, then we can look. She was underlining this plus, which is in the woman, which is motherhood, which is not expressed necessarily with the fact of giving birth, but which is expressed with a wide range of things, which remind us the need of complementarity. So that's also the reason why I stayed on the panel at the beginning, because otherwise there were only women. But that's I'm really grateful for this conference. It reminded many personal thoughts. A woman was apart from my mother. Was very instrumental to my life, also to my spiritual life. Who's going to her canonization process is going to start next week in Madrid. There was a Spanish woman, Carmen Hernandez Barrera. When we were meeting with her, she was always reminding about the factory of life. So it was a bit strange, the factory of life. And it does not mean reducing the woman to the motherhood, but on the contrary, highlighting the pressure, the priceless treasure, as our federation said some years ago with the resolution, the priceless treasure that is mother. You cannot put a price on motherhood. You cannot put a price on the work of women and their contribution to the society. I would like to also thank Shannon for her contribution, also because I really felt this complementarity and on this migration aspect. And left behind children, not only left behind children, but also, as you said, left behind parents, elderly people, those who are behind, and often migration is portrayed in very ideological terms, but in most of the time migrating is not a completely free choice. It's also linked to pains and to situation of poverty. So this is very, very, very important. And thank you very much for this contribution. I wanted just to conclude. I think I really quoted, yes, Dolores Sanchez. I don't know if she's still online, but she also gave this global perspective about this question of women and how we have to respond to these challenges with global responses. As the Federation of Catholic Family Associations in Europe, we have expressed our opinion. We contributed also to the consultation for the strategy, for the care strategy. We highlighted as well that precisely because of this very, very profound, deep connection between the contribution of women and the contribution of families, we cannot accept a one-sided solution when it comes to care. We cannot accept neglecting the role of families. We cannot accept the idea of speaking about children participation in the school, because children are not workers. Children go to school as an help to their education, as a support. So this is what we wanted to remind here, and we thank you very much, Father Manuel. We thank COMECE for the great cooperation we have, and this is just part of the work. Thank you very much for coming here. I wanted to add one quote I found very inspiring to end this event today, which is the closing message of the Second Vatican Council. I think we can do that here, and in this message, which was quoted by Saint John Paul II at the end of Mulieris Dignitatem, it was very encouraging, and I will end with that. When they said the hour is coming, in fact has come, when the vocation of women is being acknowledged in its fullness. The hour in which women acquire in the world an influence, an effect, and a power never hitherto achieved. That is why at this moment, when the human race is undergoing so deep a transformation, women imbued with the spirit of the gospel can do so much to aid humanity in not falling. Thank you very much.
There's coffee if you want, and some
yes.
in case you need some. Thank you very much for all the online participants. We will now close the event. Thank you so much for attending, and yes, we will receive on our different websites further information or follow-up events. Thank you very much.